Patient is a 55-year-old Asian female. Patient is 5 foot 2 inches tall and 110 pounds. Patient had a blood pressure of 110 over 70 when checked by her physician. Patient stated she had a fall prior to her fall, she stated she felt dizzy. Due to blood pressure being within normal range, I suspect the patient may be experiencing hypoglycemia. To confirm this, I shall order a series of tests to also rule out other potential causes. A blood glucose test to test the level of glucose in the blood shall be administered along with a Benedict's region test to determine the presence of glucose in urine. In a blood glucose test, glucose in the blood reacts with glucose oxidase and oxygen to form gluconic acid and hydrogen peroxide. The hydrogen peroxide reacts with horseradish peroxidase with colorless potassium iodine. A small bulge in the glucose meter oxidizes the hydrogen peroxide in the test strip, and the current created is measured and converted to milligrams per deciliter. In the Benedict's region test, copper Cu2+ reacts with the aldehyde functional group on glucose, oxidizing it into a carboxylic acid. Cu2+ is then reduced to Cu+ in the process, creating copper 1 oxide. Depending on the amounts of glucose in the blood, the region will change from blue to orange. The results of the glucose test. Patient had a blood glucose of 60 milligrams per deciliter, which is low. The Benedict's region test came out blue, which means it tested negative for glucose in the urine. According to the blood glucose reading strip, the patient had a blood glucose of 100 milligrams per deciliter. Normal blood sugar levels range from 70 to 100. A creatine kinase test was also ordered to determine the levels of creatine kinase in the body as well as a lactose dehydrogenase test. Using an enzyme versus absorption test by measuring how much light at a specific wavelength a solution absorbs, one can determine enzyme activity. Increases in absorbency are indicative of higher enzyme activity. Both CK and LDH at elevated levels indicate tissue damage if present in the blood. Normal ranges for an adult female for creatine kinase range from 15 to 160 units per liter. Normal ranges for lactate dehydrogenase for an adult female range from 100 to 255 units per liter. Creatine kinase enzyme levels tested within the normal testing range at 56 units per liter per minute. The patient had normal levels of LDH testing at 126 plus or minus 4.37 units per liter per minute. A urinalysis was ordered to measure the pH, specific gravity, as well as to test the presence of ketones, an Elric's region test to test for the presence of bilirubin, and a test for the presence of protein in urine. Urine has a pH range of 4.5 to 8.0. Urine has a specific gravity range of 1.005 to 1.030 in a healthy adult. The specific gravity is a measurement of the kidney's ability to concentrate and dilute urine. This is a measurement of the amounts of particles such as inorganic ions in urine. The lower the specific gravity, the lower the level of dilution. There should be no bilirubin or protein in urine. Presence of bilirubin in the urine is indicative of a bile duct blockage or certain types of jaundice or liver damage. Elevated levels of protein in urine is indicative of kidney damage. The patient had a specific gravity of 1.01, which is within the normal range. The patient tested negative for both ketones and bilirubin. When the Elric test was conducted, there was no color change when Elric's region was added to the patient's urine, indicating normal levels of bilirubin. The protein test looked for the presence of protein by boiling a sample of urine and adding the acetic acid if a precipitate is formed. If a white precipitate is formed after boiling the sample after acetic acid is added, it indicates the presence of proteins. There was no protein detected in the patient's urine sample. Diagnosis. Due to the patient testing negative for protein, bilirubin, and ketones, having a normal urine pH, and having a normal specific gravity. I am ruling out kidney damage and liver damage. The patient had a normal blood pressure and had a normal level of CK and LDH in her blood, so I am ruling out tissue damage such as a heart attack. Because the patient was found to have a blood glucose reading of 60 milligrams per deciliter, which is low, no glucose was detected in her urine via Benedict's region test, and her complaints of feeling dizzy, which is consistent with hypoglycemia. Hypoglycemia is often defined by plasma glucose concentration below 70 milligrams per deciliter. However, signs and symptoms may not occur until plasma glucose concentrations drop below 55 milligrams per deciliter. Treatment. Treatment will include having the patient monitor her blood glucose levels. If blood glucose is lower than 70 milligrams per deciliter, patient is to take 15 to 20 grams of a rapid-acting carbohydrate, such as chewable glucose tablets, 150 to 200 milliliters of orange juice, or 3 to 4 teaspoons of sugar dissolved in water. Blood glucose test is to be repeated approximately 15 minutes later, and if it is still below 70 milligrams per deciliter, which the patient is to repeat the previous step. If after 3 to 4 cycles and blood glucose levels are still below 70 milligrams per deciliter, 200 milliliters of a 10% glucose IV solution over a period of 15 minutes should be administered, or administration of 1 milligram glucagon via intramuscular injection. After blood glucose is over 70 milligrams per deciliter, it is recommended to ingest a long-lasting carbohydrate such as a slice of bread or 200 to 300 milliliters of milk. To prevent further incidences of hyperglycemia, patient is instructed to constantly monitor her blood sugar.